Now, fatigue is the number one reason that we see our patients, our male patients here. Now, they don't have enough energy at the end of the day to spend with their wife, enough energy at the end of the day to spend with their kids. It is by far the number one reason. We work hard, we work long hours, we're not getting enough sleep, so come the end of the day when things are important, such as spending time with your family and kids, we simply don't have enough time and energy to do that. So fatigue is by far the number one thing that we see here in the office. Now, fatigue is usually caused by one of these three things, if not all three of these three things. And that is lack of sleep, hormone imbalances, and an improper diet. Now let's just take sleep and let's just break that down for a little bit here. Now, in terms of sleep, we simply just aren't getting enough sleep, or it's not a deep enough sleep, and we're not also having our day of rest, right? So how are we going to do that? How are we going to try to get a little bit more sleep that is actually a little more sleep in our schedule, a little deeper sleep, and actually trying to take some time to have a day of rest? Well, one of the first things that we can do is shut down the electronics, right? Because in our world, we are simply overstimulated. Now, our minds and our eyes actually use light, right? They use light from the sun to help signal us basically whenever it's nighttime and daytime, when it's time to wake up and when it's time to go to sleep. Well, now in the current world we live in, we're constantly exposed to light, right? We have the light from our electronics, we have the lights from in the house, when we're driving home in the car, especially from our cell phones, right? We constantly have that light in our face. So it's basically telling our brain that it's time for it to be up. It's time to wake up, to be stimulated. So if we're looking at our cell phones and so forth in the middle of the night before we're going to bed, reading our iPad, watching TV, we're sending those signals to our brain. When we finally shut that down to go to bed, it's going to take a while for your brain to actually start to calm down and actually realize that it is nighttime. Now, accompany that by the stimulation we're going to get via emails, the stimulation we're going to get from the news at night, the stimulation we're going to get from the TV. Our brain is going. It is going and going and going. So that kind of brings me to my next point. Well, when I go to sleep, my brain doesn't stop. It is racing. It is going. We're basically going 100 miles an hour and then we stop. We go to bed and we expect ourselves to fall asleep. Our bodies simply don't work that way. You're going to need time. You're going to need time to get into that sleep cycle. So one of the things we recommend is that you shut off all your electronics. You want to shut off all your electronics about 1 to 2 hours before you go to bed. Not only is it good for you, it's going to be good for the kids. It's going to be for everybody else in the house. It's going to give them a time to actually start to wind down. Now, some other things you can also try to do to try to calm this overactive mind is once you have your electronics off for a little bit, take some time, some quiet time. You can actually meditate. You can make it part of your nightly routine whenever you go to bed, shower, brushing your teeth, putting the kids to bed, whatever it might be. Try to make it a calm, rhythmic type of action, basically signaling to yourself, to your family, and to your kids, hey, it's going to be bedtime. This is when we're actually starting to wind down. You're going to be sending a message to your brain that it's okay. It's okay to wind down. I highly recommend meditation, even just for 5 minutes. There's many apps you can buy out there on your phone. Many of them are free. It's only 5 minutes, and it's a really good way to try to signal your brain that it's time for it to shut down. Now, what can you take? Are there any other sleep aids you can take? Well, there's always medications, but medications always have those side effects. So I'm not a big fan of a lot of medications, but they're definitely out there. I tell all my patients it's the right tool at the right time. So in terms of prescription medication, be sure you talk to your physician and see if that might be an option. But from some more natural options patients have tried, one thing that some patients have tried is something called 5-HTP. Now 5-HTP is a supplement that you can take, and it can actually help your brain make a little bit more melatonin while you're sleeping. We know that melatonin is a hormone that is produced while you sleep. So that's an option for you as well. There's also, you can take melatonin itself. There's also a lot of great melatonin products. There's some products that even have 5-HTP and melatonin in it together. So that's something else for you to consider. Something else to consider is a homeopathic remedy called Coffea Cruda. Now, Coffea Cruda in the world of homeopathy is going to do the exact opposite of what coffee would do. Coffee is going to stimulate your mind, cause your mind to run. Well, Coffea Cruda in the homeopathic form is going to do just the opposite. It's going to cause your mind to calm down. So Coffea Cruda is another thing you can try. It's homeopathic, there aren't any drugs in it, and you can usually buy them over the counter at many health food, nature food kind of stores. So those are some considerations. You should always discuss this stuff with your doctor. Talk to them first, see if any of these are going to be a good option for you. You can follow some of these simple steps just as a way to simply try to wind down your body and get a little bit more sleep. More sleep is definitely step one. I'm going to spend a little more time to talk about the others. hormone imbalances, and diet. Okay, so stay tuned to click out our other videos and we'll help give you more information. Thanks a lot. I'll talk to you soon.